Until now, leg amputation for patients with diabetes in Kyrgyzstan has been an almost mandatory procedure, especially when symptoms of so-called diabetic foot appear. While there are many areas of medicine such as orthopedics, endocrinology, and surgery, they don't have enough time to work separately on leg issues. The lack of time for USKA's specialists to deal with these issues led to unfortunate consequences. As a result, the country was losing its able-bodied population, getting disabled people in return, which frankly speaking, places an additional burden on the state's economy that is already going through challenging times in the face of modern difficulties. But there is a solution to the problem. With advancements in medicine and treatment approaches, a new branch of science has emerged called podiatry. Translated from Greek, podiatry means the treatment of legs, and the first person to pioneer the development of this field in Kyrgyzstan is Dr.Maksat Bubakov. He is the one who was the first to initiate the idea of developing methods in the Republic that cannot only save limbs from amputation, but also give those who find themselves in a difficult life situation a chance for a new life. Having received invaluable knowledge abroad, Bubakov not only saved hundreds of people from being crippled, but successfully brought up a new generation of personnel needed by the country. For example, with the guidance of the podiatry guru, the Podomet clinic was opened in Bishkek, and its staff works tirelessly to save every limb and toe affected by diabetes. It must be said that the students have surpassed their teacher, as the medical institution has gathered around itself both those who are skilled in saving limbs and those who help prevent the disease and treat it after the fact. Initially, the clinic was engaged only in the treatment of diabetic foot. Later, as our team expanded, we now have specialists who can perform skin grafting and plastic surgery. We started taking patients with all kinds of chronic ulcers. Currently, we're treating chronic osteomyelitis, which means we're even performing bone tissue plastic surgery now. Basically, we're expanding. I think it's very relevant for our country, considering that previously the only options for such patients were amputations or simply refusing treatment. As for the clinic's equipment and facilities, well, you can only envy it. There's no need to list everything, but we have all the tools that help doctors work miracles right before your eyes. Besides treating diabetic foot, Podomet performs other unique surgeries, and their exceptional nature is confirmed by medical experts. Surprisingly, one of these experts became a patient at the clinic himself. He's an associate professor at the Department of Hospital Surgery at the Kyrgyz State Medical Academy, Dyushimbi Sargayev. He ironically noted that diseases not only come without knocking, but they also don't discriminate based on one's profession. Even if you are a doctor yourself, getting sick is quite irrelevant, he jokes. There are many people suffering from diabetic foot in Kyrgyzstan. We need support at the state level. God willing, with the help of podiatrists, the suffering will decrease and these patients will recover faster. Unfortunately, Central Asia is lagging behind, but we are the only ones that, since this field doesn't exist in Kyrgyzstan, the amount spent on treating diabetic foot is very huge. Not only in Kyrgyzstan, but in Central Asia, they all need specialized podiatric care. So this is a pressing issue today. Such a clinic is needed and support is required at the state level. God willing. It would be better for the population if international donors purchased medicines and consumables. I think this will be a great help from our side to our population for timely and professional medical care. In general, experts say almost 90% of amputation cases could be prevented if it weren't for the careless attitude of patients towards their own health. According to them, some have been self-medicating for years, while others, for unknown reasons, completely refrain from going to the doctor. So it turns out that in the end, everything concludes very sadly. Only a small many people are still unaware that Kyrgyzstan has long had competent specialists and experts in state institutions, which, to be honest, is similar to how it was in the Soviet Union. However, here the attitude is completely different. The equipment is different, the treatment methods are different, and everything has been set up to provide. For instance, firstly, there are many people in the wards, but the treatment is completely different and of very high quality. All the medicines and everything we pay for is properly administered. Everything is excellent, and the specialists treat patients very politely because it is a matter of their prestige. They honestly carry out their duties as medical staff.
Not only does he keep his finger on the pulse, but there is also an opportunity to simply talk to each person about various topics, and this approach to his work is welcomed by his patients. According to studies, after limb removal, 30% of amputees do not survive even a year. In the next 5 years, there is a high mortality rate where only half of all those who have undergone the necessary surgery can survive, overcoming deep stress. Why does this happen? The answer is simple: when a person loses a limb. In this situation, the only correct solution is amputation of the limb. Do you think we enjoy doing this? Yes, I am a surgeon, but first and foremost, I am a human being. So I would like to see patients healthy and unharmed. And what needs to be done to achieve this? Simply consult doctors in a timely manner, do not neglect their advice, and avoid any self-treatment. If you do this, everything will be fine. But people themselves are to blame for choosing such a bitter fate for themselves. And this is sad. For instance, this patient ended up in the clinic for the second time, all because of not following the regimen and advice given to him by doctors earlier. This is a clear example of how people sometimes take serious matters lightly, especially when it comes to their own health. I blame myself for not heeding the doctor's advice in time. I'm even somewhat ashamed that I wasted so much of their time and energy when I could have taken diabetes seriously from the start. Now, what could have been saved yesterday, I've lost due to my own carelessness. Lesson learned. Taking this opportunity, I'd urge people not to neglect doctors' advice and to take timely measures to nip the disease in the bud with preventive action. The essence of this film boils down to 3 things. First, to inform the public that the time when people were forced to lose limbs because Kyrgyzstan simply didn't have a system to combat diabetic foot in the past is over. Now there's a team and a clinic that won't leave you in trouble and will fight alongside you till the end. Second, to show everyone through concrete examples what happens to those who neglect their own health. And third, we must all remember and never forget the unspoken rule that any delay can be fatal.